There was a initial chat comment in here asking the panel about CARES Act, CARES funding, and how the sharing of information and the need for interoperability of information and access to some information for patients, as we're seeing in some of the CMS rulings starting to come out. How do you see this playing out in the future, and what have you encountered potentially during the pandemic? So if we will start with you, Dr. Oliver, and then we'll move to Gary, to Brent, and then to Judy.
Sure. I'll be quick. I know we don't have a lot of time. It's going to change. The CARES Act is going to change things in a large way. Notes being released, lots of folks have been doing that across the country to really know negative effects. I think patients are more loyal to their providers. I think it's less than 5% ever encounter a problem that causes issues. I've been releasing my own notes now for the last 2 to 3 years, and I can count on one hand conversations regarding that I've had, and they've all good. So I think notes are fine. I do have concerns with results being released immediately. Not the majority of them, but I do worry about pathology results and certain scans that the patient is going to get before their provider has a chance to talk with them. It's not just have a chance to talk to them, but it's develop a treatment plan. Sometimes it's your treatment plan might be in consultation with someone. If I'm going to give someone a potential cancer diagnosis as their family physician, I want the next step in place. I want to have already talked to Dr. Wright and said, Dr. Wright, I want to send this patient to you, or whoever, and then I've got that plan with the patient. So there's some workflows that are going to need to be worked out. And as an organization, I was thankful that we had a delay. We were ready to go in November with the requirements from a technical perspective. I didn't think there was enough discussion because of the pandemic and all that of folks working through their workflows and really thinking about it. But it's coming whether we like it or not, that's for sure. I'll stop there.
To quickly follow up, the comment concerned info blocking was from Bradley Moore, so I actually had noted that comment. And I think it's a very good point, which is the release of information to patient portals. I think one thing that's going to be interesting to look at is any research that examines the increased use or the use of patient portal during COVID, and if it has increased that at all. But certainly the info blocking rules are key, and as cures will change a lot of stuff. So with that, I just throw in the patient portal thought and pass it over to Brent or Judy, whoever wants it.
Dr. Wright or Judy, go ahead.
I was just going to agree. I think it's wonderful from a patient point of view, from an administration point of view. I think as a practicing pediatrician, it's a little scary for some of that stuff to get out again before I can contact patients. And so, but it's just a change. It's going to happen, and we're going to have to figure out how to do it.
Dr. Wright.
Yeah, I'm going to take a little bit different approach to this question. I don't know if anybody follows the stock market. I bet some people are sitting there watching it on their phones as we're talking. There's an IPO that's going off today, and it's called DoorDash. And some of you may have utilized that. Here's my prediction. I like to play futurist sometimes, and I think what we're going to be faced with is Doctor Dash, and that is the reason we need a strong KHI is we're going to have this need for a lot of health information, but we're going to be seeing doctors work in a way virtually that they've never been able to work in before. And I think the strong KHIs are going to enable those systems. And I think that that's going to have to play out in the ecosystem. And why would I say that? It's not just me making a wild prediction. Just turn on a TV or a news channel and watch the Get Roman ads, or any ad that's out there that's shaving off slim areas of healthcare. People are going to just say, don't wait 2 months for a rheumatologist. Get one now. Get one at Hopkins, get one at Duke, get one at Partners. And you're going to have that Doc Dash mentality out there, and it's going to be run on systems like KHI that provide that information along with that virtual service.
Yep. Great comments. Unfortunately, we lost about 95 individuals, but we certainly gained almost 50 back during this time period. Apologize for the interruption that we had there, but again, I think a lot of great thoughts, a lot of great comments. Definitely appreciate your participation on the panel. We have not received any formal Q&As, and I believe our time is about up. So with that, I guess we can end the session officially this time. And again, thank you all to everyone who participated first and second go arounds of the panel discussion. And thank you panelists for participating, your thoughts, your comments, your vision for the future. Greatly appreciated. And thank you again also for your support of the Health Information Exchange here in Kentucky. With that, we'll end the session, and so you can move on to the next session. Thank you.